Welcome to our channel, where we explore the many layers of health and well-being. In today's video, we're diving into a topic that affects millions around the world: depression. It's more than just feeling sad or down. Depression is a complex mental health condition that can impact every aspect of life. But what exactly is depression? How does it develop, and what can be done to manage it? Let's take a closer look. So, what is depression? Medically, it's known as major depressive disorder, MDD, and it's much more than a fleeting feeling of sadness. Depression is a persistent feeling of sadness, hopelessness, and a lack of interest or pleasure in nearly all activities. People with depression often experience fatigue or lack of energy, trouble sleeping or sleeping too much, difficulty concentrating, changes in appetite or weight, feelings of worthlessness or excessive guilt. These symptoms can last for weeks, months, or even years and may vary in intensity. What's important to note is that depression isn't a sign of weakness or a flaw in character. It's a real medical condition that requires attention and care. Depression doesn't have a single cause. It's often a combination of factors. Let's break it down. Biological factors. Depression can be linked to an imbalance of certain chemicals in the brain, like serotonin, dopamine, and norepinephrine, which regulate mood, sleep, and energy. Genetics also play a role. If you have a family history of depression, you may be more likely to develop it. Psychological factors. Life events like trauma, abuse, or long-term stress can trigger depression. Low self-esteem and negative thinking patterns can also fuel depressive episodes. Environmental factors. Your surroundings and lifestyle can contribute to depression. Social isolation, financial difficulties, or major life changes can increase the risk of developing depression. No one factor alone causes depression. It's usually a combination of these elements interacting over time. Depression doesn't just affect mental health, it has a ripple effect across all areas of life. Social impact. Depression can make it difficult to maintain relationships. People with depression often withdraw from family and friends or struggle with conflict in personal relationships. Work and productivity. People with depression may have trouble focusing, experience fatigue, or feel unmotivated. This can lead to absenteeism or reduced performance at work or school. Physical health. Depression is also linked to chronic conditions like heart disease, diabetes, and even a weakened immune system. The mind and body are deeply connected, and depression can take a physical toll over time. The impact of depression is far-reaching, which is why it's crucial to recognize the signs and seek support. The good news is that depression is treatable, and there are several approaches to managing it. Let's talk about some of the most common treatment options. Therapy. Cognitive behavioral therapy, CBT, is a popular treatment for depression. It helps people identify and change negative thinking patterns and behaviors. Talk therapy with a licensed therapist provides a safe space to explore emotions and work through underlying issues. Medication. Antidepressants like SSRIs or SNRIs help balance brain chemicals. They don't work instantly, but many people find relief after several weeks of consistent use. Lifestyle changes. Exercise is a natural mood booster. Even moderate physical activity can increase serotonin and endorphins, which help reduce depressive symptoms. Mindfulness and relaxation techniques, such as meditation or yoga, can also help by reducing stress and promoting mental well-being. Support networks. Don't underestimate the power of a supportive community. Whether through family, friends, or support groups, having people to talk to can make a big difference. Depression is a complex but treatable condition. It's essential to remember that no one has to go through it alone. If you or someone you know is struggling with depression, reach out for help, whether it's through a healthcare provider, a therapist, or even a loved one. Thank you for watching this deep dive into depression. Don't forget to subscribe for more content on mental health and wellness. Let's continue the conversation in the comments below. Your voice matters.